Service, and I am Dani Williamson, and this is Theresa Greco. Dr. Motley's not here tonight. He's got some things to do, so I have been blessed to convince Theresa Greco from the Body Benefit to do this with me. For 2 years, I've been trying to get her to do a live Facebook with me. 2 years, am I right?
Yes.
Yes, and yesterday we were doing a colon hydrotherapy session here, and Dr. Motley said he couldn't be here in any way. I convinced her while I was on the table, so I'm thrilled. I'm so happy. She's located upstairs at Integrated Family Medicine, and she's got her own office up here, and we are going to have a great time tonight. While you guys are logging on, as you get on, hit your like button, hit your heart button, tell us that you're there, tell us where you're from, and then I'm going to also log on here so that I can answer your questions. But we are going to go over the history of colon hydrotherapy tonight, right? How it began, what are the benefits of it, all of the questions. I've got some questions I've written here for you, so you know. But let's get started. Tell us about colon hydrotherapy. And well, actually, you know what? How did you even get interested in this? Let's just, because your story is important.
I got started because you recommended it.
Really?
I was having gut issues, a lot of inflammation, and one of the things that Dani suggested was colon hydrotherapy. And the moment I started, I felt better. And over time, we saw pictures, thermography pictures from Victoria Bailey that showed the inflammation in my body really did leave. It did go from bright yellow and red organs, inflamed organs, to green and yellow. And so it showed, it was my proof that I needed to, it's the proof that I needed that colon hydrotherapy does work, and it takes down your inflammation.
Yes, it does. I didn't realize that I had suggested, that's years ago. Yeah, Teresa's been with me for a long time, so I had no idea. Well, what is colon hydrotherapy? What is it? What's the history a little bit? Well, something I do know is I looked up some things, and like from the 1500s, we have documented back in Egypt colon hydrotherapy.
Yes, that's
using river water, by the way, and a hollow reed. So it is much better now and way more sterile. So we're going to show you that too.
So I have, it started, we have record of it going back 5,000 years. And the Hindu Vedas are the oldest known medical texts that we have, and in those texts, it told the procedures of how they took care of their colon, how they cleansed it. They did it with enemas and laxatives, but they used, like Dani said, hollow reeds. They used bull horns and pig bladders.
Horns? No, thank you. No,
so they knew that they were feeling something. They were feeling better. They were feeling cleaner. So they were willing to do. Well, they had to use whatever they had. But just think about, back then, they didn't have the toxins, and they weren't eating the food that we're eating, and they weren't breathing in and using the hairspray and the lotions. They weren't using all of that.
Well, they weren't opening up their foods from packages, boxes, bags, cans, tubes, fake, man-made, trucked-in food, right? They were eating real one-ingredient food, and yet they still knew that they felt clear-headed when they were cleaned out, and they may have still gotten constipated. Now, you told me a story yesterday when I was on the table about some king or what have you seeing a bird, watching a bird. This is fascinating. Listen to this.
It was one of the kings, and I can't remember who it was. He had a group of men, and I researched it again, now I just forgot who he was. But he had a group of men. It was some type of priest, physician priest, I think is what he was. And he had men, and they were warriors. And they were on the edge of the Nile. And they saw a bird scoop water up in its bill, turn around and squirt it up its bottom, shake its body really tight, and then squeeze it out. So that was the original moment that they started thinking about their bodies. And then I think as the story went on, it showed that they won those wars or those battles. The men were stronger, they were healthier, they were more powerful. So I'm not sure all the details of that, but yeah.
A bird scooping it up in its beak and putting it, scooping around in its rectum and then pooping it out. Isn't that something? Wow. Well, what is colon hydrotherapy? I mean, what is it? Because I know there are probably a lot of people on here who have no idea. They think it's just an hour-long enema, right? So what is it?
Colon hydrotherapy is not a glorified enema, and it's not a colonic. It's not. So an enema and a colonic, they only will clean out the lower portion of your bowels. It will go 8 to 12 inches. Sometimes they say 8 to 18 inches, and that it will. It's just going to clean out
Basically
the very
just goes
lower.
in and goes out.
And you're only using like 2 pints or 2 quarts of
Right,
water. You're
right.
not using a lot.
Right.
So
if you've ever had an enema, if you've ever, back in the day when they gave enemas when a woman was in labor, right? They would always give an enema before you had the baby. I mean, you know, it's a Fleet's enema. It's just a little enema goes in, you hold it, comes right out. I mean, that's
and it's
what
just
it is.
eliminating those few pieces that are down in the rectum.
Exactly.
It's not cleaning out the entire colon.
Colon,
So colon
right?
hydrotherapy.
The colon is about 5 feet long.
Yes, it's
right?
however tall you are.
Okay.
Yeah. So with colon hydrotherapy, you're putting water in. It's a trickle, and we're just putting it in your entire large intestine. So it's gonna go through your cecum, your descending colon, your ascending colon, your hepatic flexure, transverse, and it's go all the way down to. Starts at the sigmoid, it ends up at the cecum. It's going to clean that whole area out. And it's just a trickle though. It's not going to, there's no power, pressure. You can barely feel it, so it's not disrupting the flora that's in the little villi of the lining of your colon. So it's not going to disrupt that. It's going to allow the good flora to stay in your body without interrupting it.
Yeah, and I think that's fascinating. We talked about that yesterday, and we'll discuss it in a little bit. Well, who could benefit from colon hydrotherapy? You know, why would somebody want to have colon hydrotherapy? What could they be experiencing then?
Well, we all have years and years of toxins built up in our bodies.
Yes.
So, but people that have skin issues, constipation, mood swings, diarrhea.
Yes.
Known parasites or worms.
Yes. Bloating.
Bloating, definitely.
What about migraines? Would it help?
Yes, it is on my list. Yes.
Is it?
Yes.
Okay, so I wondered about I have a lot of patients with migraine headaches. And I wondered about that.
And it's hydrating.
Well, what about weight?
Yes. So the average, when I have people come in and they do 3 sessions in a week's time frame, the average weight that they lose is 3 to 8 pounds in 3 sessions.
Yes.
So
I believe that because I have gained 9 pounds since January, and the bulk of that, it feels like it's been gained since I went to Indonesia, and I took a month, and traveled, and this is why I started back up colon hydrotherapy this week. But I was 2.5 pounds down this morning from 2 colon hydrotherapy colon sessions, and then I'll have my 3rd one tomorrow. So but not so much the weight; it's the bloating that's gone.
Yes.
And that's unbelievable to me.
So our colon has corrosion. It's built up. And so it just causes pressure from the inside out. You're not going to lose the chub that you have around your waistband. It's going to be the pressure on the inside full that's pushing out, giving you that bloated feeling, that full feeling around your middle. And then when you have a session, it really does, people will come out of the bathroom and they'll kind of rub their tummy and put their thumbs in their waistband.
Yes.
You can just kind of feel something's different, just lighter. So that's one of the benefits too. You will feel better.
Yeah, you do. You do feel better. I mean, you just feel better. I was laughing driving yesterday thinking, oh my gosh, I'm feeling bad because I had 2 in a row, 2 days in a row, and then I'm going to have one tomorrow. I didn't have one today, but I'm going to have one tomorrow before I leave for San Diego on Tuesday for a week. And when you travel, how you get backed up, and most people get stopped up and things like that. So, but I just felt so good yesterday. Now, the first day, I didn't. And I told you I felt really bad. But I had it was a mess, wasn't it?
Yes.
I mean, literally. And so... And we're going to show you how that goes tonight. We're not going to visually show you, but we're going to walk through it.
With somebody who's traveling, you asked one of the questions, who needs it?
Yes.
If you've been traveling, again, the altitude and that being in the airplanes, you're not drinking enough, you're sitting still, the altitude, the pressure. So traveling, even if you're sitting in a car, traveling long distance, you're just not moving. So the bowel's not, when we move, it's stimulating the bowel to be moving the poop along. If you feel like you're coming down with a cold or the flu, flush it out. If you've consumed a lot of alcohol recently and you just want to get the waste, get the rest of it out. So those are some more reasons that you might want to have.
You know, I have several patients with psoriasis and eczema.
Yes.
And do you have patients?
I
do. You have clients? Yeah. Well, I mean, I know I do. You do because I send them up here, and their skin gets better.
Yes. So I have some ladies that have they'll have dry, chappy eyelids. They'll have little crusty cracks around their nose. They'll have itchy ears, itchy throat. And sometimes they'll have it on the scalp.
You told me about this one yesterday. Tell about that.
I have a client who, she comes regularly. If she starts skipping a couple months, she has a little patch on the back of her scalp that will start to get oozy and itchy. If she goes too long, it'll come back. If she stays regular for her body, then it stays away and she doesn't have that problem anymore. So we've seen it on people's hands. We've seen little splotches or patches of eczema on their skin, on their tummy. So again, it's your body's trying, when we're flushing it out and we're hydrating our body, it cools off, it cleans out, it flushes, it hydrates everything. So
it does.
It
does.
It dries, it puts moisture in those dry, patchy areas.
Well, it lubricates everything. And you know, when you're dehydrated as well, you can't poop. We know that, right?
Yes.
And so, I mean, it's really phenomenal. And I mean, so is it painful? You know, that's something that because people always ask me, Dani, does it hurt?
Yeah. It doesn't hurt. It can be a little uncomfortable.
Well, rightly so, right?
So the only part that hurts really is when the poop is trying to move its way out. It's not painful putting the speculum in.
No.
It's not painful putting water in your colon.
No.
It just, sometimes you can get a little crampy. So if you've got a really dry, hard piece of poop stuck in your colon, and we have the water in there and it's helping it slide out, sometimes those big pieces they're trying to move through that little colon. So that
happened to me. I mean, y'all don't need to know all of this, but that happened to me. The first day was not good with this. What day is today? Sunday. Thursday. Was it Thursday? I don't remember. Friday. Okay. I mean, not good at all. And you talk about those, and it was just a bunch of hard pieces, right?
It did. It came out in balls.
Balls.
And little corks. Balls and corks.
Yes, thank you. It was balls and corks, so it was a mess. But yesterday, it was incredible. I held a lot more water, right? Mm-hmm. And there was no cramping. I didn't have any cramping or pain anyway, but I mean, it just came out in the very beginning. It was kind of like it started off the first day, but then it was just, it flowed.
And it kept coming and coming. And you couldn't believe, because you said you hadn't eaten a whole lot.
It's unbelievable. And somebody shared when I shared we were doing this, one of your clients was on there, and she said she just had a session, and it's unbelievable how much comes out.
Yeah.
It's unbelievable. I don't even think about it. You got 5 feet in there.
Yes.
But technically what you eat today should be gone tomorrow.
Yes.
Most people, it's not.
No. We'll see people and we'll look at their poop as it's passing through.
Yes. I can't wait to show you all how this looks.
It'll be clearly a mushroom. It'll be clearly a tomato, whatever.
Carrots.
And I'll say, oh, I see mushrooms. And they'll look at me with this blank look and they'll say, I had mushrooms 3 days ago.
Yeah.
So obviously our body is not eliminating properly. Or we're corroded. The colon is corroded and the muscles can't move well. So it's not getting that poop out fast enough. And so the longer it sits in our body, it's going to ferment.
Yes, it does.
We're going to get gassy. We're going to get bloated. We're going to feel uncomfortable. We're not going to sleep well. So we need to move it out and get it out faster. So part of moving it out, though, is the muscles. The muscles in our colon have to be strong. They have to be toned in order to move that poop along. If our muscles are tired and sluggish and we've got too much buildup on our colon walls, it's not going to do its job well. Then we're going to get sick, and all those toxins and those poisons are going to circulate back into our system, into our bloodstream. So that's going to make us sick. That's not going to heal us.
You're right. You're right. I mean, you have to get it out. You have to. What goes in has got to come out in a timely fashion.
And Dani's always said, not just Dani, but our gut is our body's second brain. So whatever is going on in here will affect the way we think, the way we sleep, our moods.
Anxiety, depression, bipolar, schizophrenia, ADD, ADHD. And in fact, let me talk about this. I first learned about colon hydrotherapy when I worked at Cool Springs Family Medicine, right? So, Dr. Cal treats a lot of autistic patients. And colon hydrotherapy, if you have an autistic child or know someone who has an autistic child, Down syndrome, those children and adults, when they become adults, they have a very difficult time eliminating properly. And many times they will go a week or so without having a bowel movement. And it is absolutely fascinating how great and how beneficial colon hydrotherapy is for those patients. And I really learned about that there. So, so how many treatments does a patient need? Because patients always ask me this. And so how many do they need to get started?
When you're starting out, if you hadn't had them in a long time or you haven't had them at all, we always want to start out with at least three within a week's time frame.
Yes.
You can skip a couple days, or you can do them back to back. It doesn't matter either way, because we have got so much toxins in our body. We want to make sure that we're really flushing it out. If we only did one session, we could have just stirred things up, and you may feel a little queasy. You may get a little lightheaded.
That's right.
So it's important that we really get it out. So I always start with 3 with my clients, and then I really encourage them to notice what they're feeling, to be intentional about just being aware of what's going on in their body. And I don't want to push it on anybody to do more. I really want us to start knowing what our body feels like when it's healthy, knowing what it feels like when our colon is empty or clean.
Oh, wow. I think you just forget how it feels to feel good, right? And to feel light and to feel clean. And I'm going to tell you, and you all that are part of my tribe, I share everything. I've pooped like a goose since I was a little kid. I had diarrhea for years. I mean, I've never been constipated a day in my life, not one time, until summer of 2018, when I went from Nashville to Indonesia to Hong Kong, to Australia, back here home for 48 hours, and then back to Scotland. It has been a bloody nightmare for a solid month for me. I've never experienced anything like this, and I couldn't believe how bad I actually felt and didn't even realize it. Only after 2 colon hydrotherapies, I feel like a completely different person, mentally sharper.
You said that even after the first one, even though you still had so much more in there, that you just felt a little different.
Yeah. It really is. It is something. And so 3 is generally how we start.
Yes.
And then people come. You were telling me that some people, you have a fair amount of husband-wife couples who come on the full moon. The full moon.
Yes.
So
when we have a full moon, the gravitational pull is different.
Yes.
So in hospitals, ladies go into labor.
Yes.
Car accidents. The crazy people are the people with.
Yeah, the ones that they always say, oh my gosh, they're acting crazy, there must be a full moon. Yes.
So it also affects the parasites in our body. They become more active. So if you're ever going to do a cleanse, a parasite cleanse, it's always good to do them so that you're ending your cleanse right like the night before a full moon, or somewhere right in that time frame. And then you come in and we make sure that we're really flushing them out. But I do have husband and wives that come on the full moon, just to make sure, because they've struggled with parasites, so they have a much better relief. Sometimes we've seen them come out. We saw one man, he released one that was the size of a bologna. It was pink and grayish.
What?
It looked like a rolled up piece of bologna in the tube with little warts on it, and it had little tentacles on it.
Are you serious?
Yeah. So he almost went white, but I kept telling him, well, better out than in. Better out than in.
Better out than in.
And then he came back the day after or 2 days later, and we saw a lot of little green eggs. The nucleus was
goodness.
Dark green, and the membrane around it was a very light green, and probably 200 to 300 of those.
Teresa, so we all have parasites in us. Don't think that that's crazy. That is a little extreme, though. We all have parasites. Yeah. Every one of us have parasites. It's just, do they cause damage? Do they cause trouble for you? Do they create health conditions for you? And we should be eliminating them. But we all have parasites. Now, I don't know so much about the big ones. I know that I have a patient who travels the Congo and goes down the Congo quite a bit and things like that, and I sent him up here to see you, and there was this sucker one that came out, like with suckers and tentacles and stuff on it that he told me about it as well. And so I haven't seen anything like that, but personally
we've seen liver flukes come out, many liver flukes, and this one patient, she had been feeling very sluggish, but she thought it was just the stress in her life. She thought it was the things in her home. But once we saw them come out, and then I think she had a round of medication or something to help her make sure that she was eliminating them. Then she felt better. She wasn't feeling dry. So those little parasites were sucking all the nutrients out of her food.
Yeah. Isn't that something? Somebody wants to know if you have an opening tomorrow. Stephanie, yes.
I actually do.
All right, so well, not my appointment. I think I'm going to be up here at 5:30 or something like that.
Yes.
So, all right, so, okay, what do they need to do to prepare? Hey, you guys, if y'all are watching, hit your like buttons and hit your heart buttons so that we know you're on here. And if you have any questions, pop them up here because Theresa will answer those afterwards, by the way. But what do they need to do to prepare? Unlike a colonoscopy, you don't really need to prepare much, right?
You don't want to eat too close to your session because I'm going to be on the outside. I'm going to be rubbing your tummy. So you don't want to eat too close to your session, and you don't want to be drinking water within 2 hours of your session. Your bladder will fill up, and it just makes it a little harder to eliminate. But it's super easy. There's not a lot of prep work.
And I had said, what can you expect to feel? But we've already discussed that. You know, and I mentioned a colonoscopy just a second ago. There's been some research, and I don't have these citations and all off of PubMed with me, but there's some research that your colonoscopies are cleaner and they see more when you prepare for a colonoscopy with colon hydrotherapy as well.
And just recently, I think I've had about 4 people in the last 2 weeks that had their colonoscopy scheduled. Actually, one is scheduled for Monday, tomorrow.
Here's what I tell. Here's how good Theresa Greco is with this. She actually has a gastroenterologist who comes and sees her. And when you get a gastroenterologist who believes in something like colon hydrotherapy, that's a big deal. And this person is in here seeing Theresa, and I am thrilled with that because I know that that's a big deal.
It just brings validation to what's going on because he works with with colons all day long. So to have a gastroenterologist come in and be impressed, or he can feel the water going in and he'll be talking out loud, you know, what's going on. So he knows that.
Well, it's a great anatomy lesson for you too because he's talking about all that. So I think that's fantastic, and we need more physicians like that who are open to things like this, right? To help. This is not going to hurt you, and it is going to help you, right? Is it dangerous? Are there any contraindications? Who should not get a colonoscopy? I mean, a colon hydrotherapy session. Is there anyone?
There are.
Okay.
There are.
Okay.
Let's see if I have my list with me.
Well, I would
think they're the severe.
You know, I would think that anyone who's had any sort of rectal surgery, most likely, or rectal cancer, or anything like that, probably does not need.
And that depends, though, if it was on the inside of the colon, if it was just attached on the outside of the colon. If it's on the outside, they've had, it was approved. It was okay for him to have it done. Oh my goodness. I have a list.
It's fine. I threw you off the top here. Well, I don't know. Well, I mean, because people are going to ask, you know, who should not do that. But somebody's asking here, will it help with candida?
Yes. Oh, absolutely.
And would this trump a candida cleanse? Now, this is my friend Bonnie from high school. We went to high school together. So, hello, Bonnie. So, will this trump a candida cleanse? Yes.
It
doesn't. It's not going to. Yes, go ahead.
It's not going to. Candida cleanse, this works hand in hand with. The candida cleanse is going to go in your small intestines, it's going to be moving through your stomach, it's going to be going through your whole system. Colon hydrotherapy flushes it all out.
Yes. So
at the end of your candida cleanse, at the end of any cleanse, we're instructed to follow up with the colon hydrotherapy so that we're completely eliminating it, that it's not just going to stir up or go from one area of your body and get stuck in your colon because your colon is corroded with old fecal matter.
Right,
Yeah.
right. So talking about contraindications, this is really good. And my friend Robin in Paducah said, will it help with diverticulitis? Actually, Robin, that's a contraindication. Diverticulitis is. So you would not.
Diverticulosis we can still do. Diverticulitis we can't.
Absolutely
it's taking
not.
it to the next level.
Anal fissures or fistulas, rectal abdominal or recent abdominal surgery. I'm sorry, pregnancy, of course.
Okay.
Recent colon or rectum surgery, abdominal hernias or inguinal hernias, right? Carcinoma, cancer of the rectum or the colon.
Yes.
Cirrhosis of the liver. Okay, now I didn't know that, and actually I would have thought that it would have helped cirrhosis of the liver. So that's interesting. Okay, but you do see liver releases on
yes,
here.
we do.
And so this is interesting. Now, I haven't had a liver release,
Not
but
yet.
when your liver releases,
Yes.
what does it show?
The water in the waste tube that's coming out of your body is bright yellow. Sometimes it's almost oily, and sometimes it's so yellow that it almost looks like antifreeze that you put in your car, like
my
Gatorade. It
goodness.
is so yellow. And sometimes it'll even coat the waste hose as it's leaving, and it will be oily and sometimes a little foamy. So that's a good release. Sometimes the patient will release, their liver will release, but it'll be more yellow, just a soft yellow. It almost looks like urine, but that's when your liver has let down. And usually the people will say something like, "Oh, I feel something." Like they can almost feel like chills, They'll get chills on their arms. They may get a little sweaty just for a second. And then once it's released, then they feel better. So it's always fun to see. And I always am hoping that somebody has the liver release, because I like to tell them about it ahead of time so that when it happens, they're like,
well, I want my liver to release tomorrow before I go on this conference.
Yeah.
Advanced Crohn's disease, right, which is irritable bowel disease, or ulcerative colitis, irritable bowel disease. Severe hemorrhoids, of course.
Yes.
Severe hemorrhoids.
Little ones, most women have them.
Yes, they do.
And it doesn't bother them at all. It's just the severe ones.
Perforation, hemorrhage, severe anemia. Huh. I wouldn't have thought that. An aneurysm in the colon. Okay. Heart valve disease, congestive heart failure, or uncontrolled hypertension.
Yeah.
Those are contraindications.
Yes.
So that's something good to know. We're going to talk about, will it make you constipated, or will it give you diarrhea?
No. Now, sometimes when we're cleaning out the colon, remember it's 5 feet long. And when I go in with that water, it's going to empty out your entire colon. So when we go number 2, we don't ever empty out the entire 5 feet. We eliminate just that very last portion normally. So now when I go in and we're massaging on the outside, or we're getting your whole colon to release. So it may take a day or 2 for your body to catch up, because normally when we poop, you eliminate the bottom portion, and then all the other portions jot over. They jockey over to the next position. So, we don't poop the whole 5 feet. So if I'm cleaning it out, it may take a day or 2 to catch up. Now, it shouldn't be that way. But my clients that have a really strong, healthy colon and they eat well, they'll go potty the next morning. That's a good, healthy colon. The people that have a little bit longer, it takes a little longer, couple days for them to have their first bowel movement. That shows that their colon is not healthy. It's not strong. Those muscles aren't working. Their peristalsis is slow. There's still buildup in there. So yeah.
I have a good colon now. Now, I did not for years, but my last colonoscopy, Dr. Lindsay said, "Oh my goodness, your colon's perfect, best whatever," right? 5 colonoscopies, finally the one at 50, I worked it all out and it looks really good. It is fascinating to feel your colon, to physically feel the peristalsis.
Yes.
And it shakes the tube.
Yeah.
It's odd. In fact, we're going to talk about right now, we're going to show you what happens during a colon hydrotherapy session. We're not going to do it tonight, but we're going to have a colon hydrotherapy session.
Yes.
so that you see how it works. I mean, I have zero problem showing you all tomorrow my colon hydrotherapy, but I think my office manager would quit on the spot if I did a colon hydrotherapy session live. She would never come back again. She'd be horrified. Doesn't bother me. I don't care. I could care less. You don't see anything. And this is something I want you to know. In fact, we're going to do this because you're going to show how discreet it really is.
Yes.
And so no one, she doesn't see anything. So we're going to actually come over here and show you exactly what happens. Now, normally you would get on this table from the other side. Okay? All right, Teresa, you show them.
Okay. So,
And you would not have your clothes on. You don't have your pants on, of course.
I have had 2 ladies come to the table and they still had their pants on. We had to send them back to the bathroom.
Are you serious?
They were so nervous.
This is what I used to tell women when I was delivering babies, right? I'd say, you can't deliver a baby with your panties on. You probably didn't get pregnant with your panties on. You're not going to have a baby with your panties on. Get in there and take your panties off. So, okay.
Okay, so what we do during a session, you have a little gown on,
Yep.
and then I cover you with a towel.
Yes, a beautiful towel, by the way.
And then this is the speculum that goes into your bottom. About this much fits inside, so it's about 2.5, 3 inches. I will lubricate it, and I will lift up the gown, and I'll ask for your permission, and I will put the little speculum in your bottom.
Yes.
Then, so this hose right here is the water hose. This is the purified hose where all the water comes in. And see how
And
tiny
then
that
you
is?
roll over.
It's a little tiny hose, and it's just a trickle. So as she's on her back, I will be holding this so the speculum doesn't slide out. This is the waste hose, so I will connect this hose to the speculum. So all the waste comes out of this. All the good water comes in through this hose. And then as it leaves the hose, it's gonna come through here. This is called the view tube. And
I tell people this is like the aquarium at the Atlanta Aquarium. You can watch everything go by.
it'll come through here. And I can slow it down or stop it. So if I need to collect it, if we have a parasite coming through, I can collect it in here. Many times I've put them in Ziploc bags and sent it home with the client so they could show their children the bugs that they have in their colon.
Oh my goodness.
So it all comes through the view tube and it goes into the sewer. We never smell it. We don't see it.
No.
It all is discreet and goes away out through the toilet. And then halfway through the session, we do what we call a coffee enema. So coffee enemas are great in general, just to do them at home. So this coffee line is connected to this water line here. So I never have to reinsert. It's the same little procedure. I just flip this little dial here, and the coffee will go in. And we'll let that soak for a few minutes. We did that with Dani the other day. And as she's holding, she felt her peristalsis kick in, and she needed to release. So the coffee stimulates your colon, and it heals your colon, it heals your liver. It's because of the acid, it kills the parasites or helps get them out.
Stir them up.
It helps with your moods, helps with your mental clarity.
Yes.
So a lot of my clients, I try to get them to do coffee enemas at home as well. And then, so Dani's peristalsis kicked in and she had more poop to remove. So it all goes through the tube.
So let me tell you all something. The first day she did this on Friday, I couldn't hold that at all. I mean, she released it in and I could not hold it. I was like, get it out now. I can't do it. Yesterday,
the whole thing.
The entire thing. Took the entire thing in, not a problem. And then when she released it, it was like, oh my goodness. It's fascinating. Now, I don't know if most people are, but I'm like up like this, looking in there, trying to see what's coming out of there and all. It's really fascinating. I'm sure there's some people who lay here and never look at a thing. I have had colon hydrotherapy. Everyone else who's ever done colon hydrotherapy on me has done it on my side, and you couldn't see. The beauty of Theresa doing this is, number one, she has state-of-the-art equipment. It is the best equipment on the market, and we need to talk about that closed and open systems. But she massages your belly. So you're laying like this. There's no discomfort whatsoever, and she is physically, I've never had any colon hydrotherapist touch my belly before.
That's so important.
She rubs it and massages it, and I think it just helps you release.
Yes, it does. So if our colon is full and has dried fecal matter, and I've got water in there, which is softening it and it's loosening it. But if I massage it and kind of push on it, it's going to make those pieces break off. Those dry, hard pieces come off the walls of the colon. So that's what I do. And then there's also areas in your tummy that trigger. So sometimes I can hold a spot and then we'll feel that peristalsis kick in. So there's a couple little magic spots over here, a couple over here, and we even have them up under this rib, way in the far back. And sometimes I'll rub that, and people will just, it'll just swoosh out so fast. And I'm out holding the tubes, making sure that, because it will fly by. So we do massage the tummy, and then at the very end of your session, so we all have good bacteria and bad bacteria, and we can't tell the bad bacteria to exit and keep the good bacteria in. So we want to make sure when you're leaving, the good bacteria and the gut flora and all the mineral, everything that are good is better. So this is the second implant, and at the very end same thing, flip the little dial, we let it go in. There's probiotics, prebiotics, glutamine, bifidophilus, acidophilus, chlorophyll, glutamine, vitamin C, minerals, Saccharomyces boulardii, all the stuff our body needs to have a healthy gut and to keep that gut flora thriving and full. So so we put that in, we again hold that for a little bit, and then we let it release, we let it trickle out. I'll massage the tummy, try to get a little more out. But we don't
and more comes out.
Yeah.
It's fascinating. And it takes about an hour, you think? Yeah.
The first one usually takes a little bit longer because they might be a little more backed up and it takes a while to get things rolling. And also I'm answering questions and talking, and I'll walk you through every little step. We've got the temperature gauge that triggers the peristalsis to move. So during the session, we'll be toning your peristalsis by changing the water temperature. And then also when we give you a fill, the water pressure is only trickling in at a 0.5. So it's super low. It's just a very small trickle.
Yeah, you don't feel...
It's not a spray.
You do not feel anything uncomfortable or painful at all. I would say that the most uncomfortable part, and it's not uncomfortable, but until you get used to it, is the fact you have to get used to the fact that you're going to release. So you have to relax.
Yeah.
You have to release, because your thought, it goes against everything in our being to poop laying down in a bed, right?
With somebody standing
with
next
somebody
to you.
holding a tube up there and smiling at you, as pretty as she is. Nobody wants to poop on the bed, and so you have to get that in your head and just relax.
Yes.
And I'm telling you, and I don't get uptight about anything really, but Thursday I must have been more uptight than I was yesterday, because yesterday or Friday or yesterday was just like, oh yeah, I mean, how much easier was it? So definitely you need 1, 2, 3, and I'm ready for tomorrow to do it and see. But that's the most uncomfortable feeling, would be the fact that, oh my gosh, I'm going to poop. And you have to release.
Just relax.
Relax, so that you can release.
Yeah. And it just all goes out the waist tube. It just all goes right through here.
There's zero smell.
Yeah.
Nothing.
So I had a young boy come in. He had never had an antibiotic. So last August he went to some camp and he got an ear infection. So his mom had to finally take him in and have an antibiotic to clear up his ear infection. Well, he had never had trouble pooping, but from August until December, he was struggling, and the mama was giving him everything, but he would, it just wasn't like normal. That antibiotic really messed up his gut. So she told him about colon hydrotherapy, and at first he was like, never, because I think he was a young teenager. So finally one day, it hurt so bad, or he was so uncomfortable at home, so he finally said, what is it again? So he came in, and the poor guy, he was so backed up, but it was that relief. It was just, he felt good again. So he did come for quite a few sessions. He did his 3 up front in the week, and then he waited a couple more weeks and he came again. And then over time, he's been able to dwindle off. I haven't seen him in probably a month or 2. So so I just love that, because sometimes we have to take prescriptions. Sometimes we have to take
Yes, you do.
an antibiotic. So, but it can mess up the flora in our gut.
Yes.
So he just needed help, and
he needed help, and you were here to do that. So do people do their 3? You have regular clients,
Yes.
right? And do they come every month,
So
3 months, 6 months? What's the protocol?
Protocol is once a month for maintenance. I tell my clients that, but I also say once you've had your 3, you now know what good feels like.
Yes.
You know, oh, this feels nice. I'm sleeping better. Whatever, you'll have whatever your symptoms were before, they'll have subsided or gone away completely. And so I want the whole purpose of all this holistic health, you got to listen to your body. You need to really pay attention to what's going on. So I try to encourage my clients to come when they need it. Don't wait too long, over another 8 months or so, and then you have to do 3 again. But really just be aware, notice, think about the things that you've done, things that you've eaten, if you've traveled, if you had alcohol, alcohol, a lot of consumption of any bad thing,
right,
a big party,
right.
whatever. So just be aware. And most people, they get on the schedule either
Yes.
once a month or every so many.
Oh, I see my patients coming in and they bounce down the stairs. It is so funny when it's over and they come in the office and do whatever and say hello and oh yeah, you feel like $1,000,000. And then when it's over, you sit up. She discreetly
wraps it all up,
does whatever needs to be done, and you get up and you go to the restroom, and then most likely you're going to release more. Correct?
Yes, because first of all, while she's on the table, she's laying flat. When you stand up, the gravity is now going to drain out.
Yes.
So that's what the toilet's for. You're going to go in there, and you'll go a little bit more. I tell everybody to lean over, poke a little bit in your tummy, to see if you can feel any more water. If you just sit a little bit, you'll hear the water trickle out. And afterwards, you won't feel an urgency to find a bathroom.
No, you will not. I shopped all day yesterday getting ready for this conference. I was at TJ Maxx. I was all over the place. Not one time did I have a problem. Nothing.
You'll know, I got to go to the bathroom. But you don't have to run to the bathroom. It'll just be a normal, gotta go.
Correct.
So.
Okay, we're going to sit back over here. I'm going to get off of this table. Teresa, thank you for that. So she does. Speaking of, she has the state-of-the-art, for sure. She has a closed system, correct?
Yes. Closed. So open and closed are the 2 types of system, or there's other ones. Closed means everything's going to go out the drain. It's going to go to the sewer. There's no smell. An open system, it's the little hose. It's a completely different. It's a big machine, and you're sitting on like a glorified toilet, and you're kind of reclined a little bit. And there's a little straw that goes up your bottom. And as the poop comes out, it's going into a little toilet apparatus. But it's going to go down the drain. But you can smell it. But usually the open systems, you're by yourself. But the open systems are really, the benefit of open system are for the children with autism and Down syndrome. And usually the mama will be in there with them.
Oh, okay.
Yeah. So
I didn't know that.
The open systems, the water doesn't clean out the entire large intestines. It only cleans out like a colonic or a enema. It's only going to clean out that small portion, the lower portion. But that's where most of the constipation happens in those children.
Well, true. That is true. Well, okay. So we have some questions on here. She says, I've been out of town. Donna West, I love you. I've been out of town. I've been eating horribly. Should I eat clean for a little while before setting my appointments? Not necessarily. No,
I wouldn't wait.
No, don't wait. Get it done now. And then Paige Lee says, how young can a person be to do this? Age-wise.
Age-wise, 18 to 70 is the normal age. If they need it before then, I just need a doctor's note. If they're older than 70, I need same thing. If they're younger than 18 and older than 70, I need a doctor's note. So I do have both.
Well, that one guy was 15 that you were telling me about.
Yeah.
Mm-hmm. Yeah.
So,
what are the prices? And tell me about your hours and how we can get in touch with you.
Okay. A package of 3 to start out is $325. Mm-hmm. If you later continue to do just the once a month or just need one session, then it's $115.
Okay.
They reach me,
which is a great deal because there's no price tag for health. I can tell you that right now. And what you do, and I've had other colon hydrotherapy sessions, what you do. I've never had anyone
Right.
re-inoculate me
Yes.
with great bacteria and spirulina and
Yes.
coffee and all of
Yeah.
that.
I
I've never
believe-
had that,
I
and
believe I'm
there's
the
a
only one in
significant
town.
amount.
Yeah.
Who does the implants?
Yeah, I believe I'm the only one in town that does the implants. So, and I
Well-
was trained out in California and Arizona, and that's just how they do it out there. So I wanted to bring that back again. Like Dani said, you want to make sure that the gut is healthy.
Well,
not
I
just
just
clean.
wonder, and I just thought of this because I was talking to somebody this afternoon about this. Do they do CBD colon hydrotherapy?
They do.
They do?
There's many types of implants. You could
Oh.
do, yes.
Wow.
Apple cider vinegar.
Really?
Yeah, there's so many different types.
Think
to
about
do.
CBD
Yeah.
colon hydrotherapy for patients with anxiety and insomnia and chronic pain, right?
Remember years ago, they would give us medication rectally.
Yes.
Remember because
Oh, yeah.
the
Well, the rectum absorbs everything
Yes.
beautifully. It's like the vagina. I tell patients when we're putting hormones in people, when we're doing, I mean, they make CBD in suppositories, you know, so it makes perfect sense.
Yeah.
Wow. Okay, so the price is $325 for 3, $115 for 1. Going down the road for maintenance. How are they going to get in touch with you? You have a website.
I do. It is thebodybenefitfranklin.com.
Thebodybenefitfranklin.com, and I actually have connected that to the link. Once this is over with, you'll see. You can click on that. Also, you have a Facebook page you all need to like and follow.
And it is The Body Benefit.
Yes, and that's a public
On
page.
Yes, and that is on Facebook.
And she's actually going to answer your questions. So if you have any questions on here, feel free to post them. Theresa, oh, and what's your phone number?
615-944-8865.
Okay. I appreciate you more. Do you have anything else to say about colon hydrotherapy that you want to share with these people before we sign off here? I appreciate you doing this.
Thank you. Thanks for having me. It was an honor to be
Oh,
here.
goodness
Appreciate
gracious, of course.
There's so much. I mean, usually when you're on the table, there's so much to talk about. And
Oh.
you can ask questions. Right now, nerves and all of this. I can't remember exactly what we've hit and what I need to. If there's anything else?
Well, I
need to
think
say.
we've covered
Good.
a
Yeah, I
lot,
feel like
and
we
then
have.
she will answer questions whenever we need to, or whenever we finish with this. But I don't have any more questions. What I can attest to, excuse me, is that I can't believe how bad I must have felt. I'm just surprised. So I'm really looking forward to this time tomorrow. Well, no, this time tomorrow night I'll be finished. But I am a true believer. Now, Teresa's been up here 2 years. I have never once in 2 years done my 3 sessions in a row. I've been very sporadic because I've been busy. But both my kids have done their 3 sessions in a row, and both of them, one of them in particular, wants more colon hydrotherapy because they feel better.
You can feel a difference. You really can.
Yeah, it really is something. So, you know, and you can't argue with history, right? Something that's been going around for 5,000 years, and, you know, trust me, this is way better than a bullhorn and a pig skin or whatever it is.
Pig bladder.
Pig bladder that they used to use. So anyway, guys, I appreciate you all. Next Sunday night, I will be in San Diego I leave Tuesday for the JJ Virgin Mindshare Summit. And so it's a summit with all the leaders. Mark Hyman, anyway, it's a little private summit, and I was blessed to get invited to be there, and I can't wait to be there. And I'm going to say a prayer that I can do it live from San Diego and have Trudy Scott, maybe Mark Hyman, JJ Virgin for sure, just kind of pop in, and Isabella Wentz is going to be there. I'm really excited. Everybody that we love and that we watch the summits on and that we read their books will be at this summit, teaching us how to reach more people, you know, and so I'm excited. So that'll be next Sunday night. For those of you who are in town and local, we had our first Lunch and Learn series of the season on Friday, and that was with Designs for Health, learning about fish oil and brain health and all that. Teresa was there, but I am so excited. August the 24th is Donna Durham, who owns Waiting Comforts. Waiting Comforts are the weighted blankets for anxiety, autistic patients, anybody who has, well, anxiety or needs a weighted blanket. I am so excited about that. That's a Nashville company, by the way. She will be here sharing her story of how she hires refugees, by the way, to make these blankets. I am so excited. She's going to be downstairs here, and she's going to bring blankets for sale as well. So that's exciting. August 24th, 11 o'clock. Good Christmas gifts, yeah. And then August the 31st is Chad Yarborough from Maximize Genetics, and I can't wait to have Chad here. I can't wait to get my genetic test back. So he has a new weight loss panel that is phenomenal. And it looks at all of your genes, or not all your genes, but a tremendous amount of genes and SNPs, you know, why you may not be losing weight, etc. He has a combo panel, an MTHFR panel, Alzheimer's, all kinds of things. So that's August 31st, 11 o'clock. So those are the next 2 lunch and learns. I'm really excited about that. So Theresa, thank you. Thank you so much. We had all kinds of, Bonnie says, does this curb cravings?
It actually does. A lot of people say that. Yeah, and in our training it said that as well.
Really?
Yeah, it does. Because it's flushing out a lot of the candida, which makes us, and the yeast, it makes us crave.
Oh, it does. It makes you crave, right?
Yeah, so it does help with that. I'm glad you asked. Thank you.
Oh, Beth Worley, she says, sweet, sweet ladies. Thank you, Beth. We appreciate you. All right, guys, put your questions up here. We appreciate you. We love you, and have a fabulous week. And thank you so much. I know it's a big deal watching us on Sunday nights, but you can share this with anybody you want. You can click share and send it out. All right? We'll see you next Sunday.
Have a good night.